Hello, I'm Juzali and welcome to my presentation where I'll be discussing all about latanoprost. Let's begin. To begin, let's talk about the therapeutic class of latanoprost. Latanoprost is an anti-glaucoma agent. What does this mean? Well, it basically means it reduces the effect of glaucoma in patients by the reduction of elevated intraocular pressure in patients with open-angle glaucoma and ocular hypertension. Glaucoma is an eye condition due to damage to the optic nerve. This is commonly caused by increase in intraocular pressure due to impaired drainage of the aqueous humor. Latanoprost also reduces the elevated intraocular pressure as an adjunct medical therapy in patients with primary chronic angle closure glaucoma. Next is the pharmacological class of latanoprost. Latanoprost is a prostaglandin analog, which means it acts on the prostaglandin receptors. In this case, latanoprost is a selective prostaglandin F2 receptor agonist, which is commonly found in the ciliary body of the eye, which reduces the intraocular pressure by decreasing the drainage of aqueous humor through uveal scleral root and the trabecular meshwork. In this diagram, the drug acts on the prostaglandin receptors on the ciliary body, which is the red circle. Aqueous humor follows the line on the diagram, which exits through the trabecular meshwork, which is the green spot, into the blood vessels in the blue circle. The ciliary body relaxes, causing the trabecular meshwork to be bigger, hence improving drainage of the aqueous humor. This then results in a drop in the intraocular pressure in the eye. Now, let's move on to the proper dosage and frequency of latanoprost. As you can see, the recommended dosage is one drop in the affected eye or eyes only once daily. Study shows that the optimal effect is achieved when administered in the evening. It's important to make sure that administration does not exceed more than once daily. This is because it decreases the intraocular pressure lowering effect, making the drug less efficient. Unfortunately, for some people, applying the eye drop may be difficult and may end up missing completely. However, the actions to take when you miss a drop is to continue the treatment with the next drop as per normal. Moving on, we'll be discussing the pharmacokinetics of latanoprost. Pharmacokinetics is the study of bodily absorption, distribution, metabolism, and excretion of drugs. In this case, it's latanoprost. For absorption, latanoprost is rapidly absorbed in the cornea upon administration and is activated to form its biologically active state by hydrolysis. Peak concentration of this drug is usually achieved in about 2 hours. Next is the distribution of the drug. Latanoprost is distributed in humans with the value of 0.016 plus minus 0.02 liters per kilogram. What this means is that for every kilogram of the human body, the drug acquires approximately 0.016 liters of space. The acid of latanoprost can be measured in the aqueous humor during the first 4 hours and in the plasma only during the first hour of local administration. For metabolism, latanoprost is hydrolyzed in the cornea and activated by esterases to become a pharmacologically active drug. A portion of the acid that reaches the systemic circulation gets metabolized by the liver to the 1,2-dinner and 1,2,3,4 tetranol metabolites via fatty acid beta oxidation. Last but not least is elimination, which is rapid in the eye as the half-life of this drug is just 17 minutes. The systemic clearance is 7 milliliters per minute per kg, and approximately 88% of the administered dose are recovered in urine. Now that's the end of pharmacokinetics. Let's talk about one side of taking latanoprost. One of the common side effects seen in people taking latanoprost is conjunctival hyperemia, or in simple terms, red eyes. What this means is that upon administration of latanoprost, the blood vessels in the eye undergoes vasodilation, causing enhanced microcirculation, or basically just more blood flowing in the eye. Next is drug-drug interactions, and I'll be talking about what happens when you take bimatoprost and latanoprost together. First of all, both of these eye drops are used in glaucoma patients and are both prostaglandin F2 receptor agonists, meaning they have the same function, which is binding onto the prostaglandin F2 receptor in the ciliary muscles. When used together, the two drugs will have a possibility to compete with each other with binding into the receptor. This results in lowering the effectiveness of each drug, resulting in the intraocular pressure lowering effect to decrease, making the drug less efficient. A precaution to take note about latanoprost is for pregnant or nursing women. Studies have shown that a small amount of drug is known to be excreted in the breast milk. However, it is deemed generally safe for the babies. In my opinion, I wouldn't mind having nursing women take latanoprost as there has not been any serious cases in the babies taking latanoprost, making it really safe. I've come to the end of my presentation. Thank you so much for listening.